Hello, friends. Good afternoon. I welcome everybody on this lovely Friday afternoon. I'm so happy to see you all once again. And this is the time I'm seeing all of you again for a special program which we've been talking on PCOS and especially on infertility. Friends, good afternoon once again from the PCOS Society. My name is Ruby Sound and I represent the PCOS Society of India and I'm the co-chair of Special Interest Group on Public Awareness. And being a committee member of the PCO Society, I am also a part of this program, which is called the Vijeta. Let me once again tell you why are we here and what is this program Vijeta all about. Friends, we know that the number of PCOS cases are rising, in our country and worldwide also. And it's very important for us to know why and how to diagnose PCOS and what are the complications if you have a PCOS as a young girl. So all this is important from the very, very young age. Very, very important thing is to identify what are the symptoms and how it can affect fertility in the later years of life. So for all this, we are conducting educational programs. And Vijeta is one of the programs by the support of Philips. We are conducting a series of webinars and we are doing different seasons. Today we are doing episode 7 of season 1, which is specifically talking about fertility among women with PCOS. In the last few sessions, we have covered the symptoms, the diagnosis, how to treat for the first line and the second line. Moving ahead today, we are going to talk on a very, very interesting and the most questionable or the topic which has a doubt in everybody's mind, assisted reproduction techniques. We will discuss in details as we go forward, and we will have our Madam Dr. Duru Shah, who will be presenting today. But before we go ahead, let's quickly understand how much of information and knowledge do you have on this subject of assisted reproduction, whether it is IVF, whether it is egg donations, whether it is surrogacy. Okay, and in later slides, you will know that what is the best treatment if you are a patient yourself. So we begin with questions. We have about 8 questions coming in front of your screen. Each one of you will get about 30 seconds to answer the question. May I have the question number 1, please? Remember, you get only one opportunity to answer. So either you answer this as true or false. So the first question is assisted reproduction technology is also called as ART. So is this a short form of assisted reproduction technology? So as we know, advances are happening in every field of medicine, in PCOS or in fertility to be very specific. There's a treatment or a technology which is called assisted reproduction, it's assisting your reproduction. Is it ART? This is the question. And I think 100% of you know the answer and they've already answered true. Okay, we go to the next question from here. The question number 2 is IVF, which is in vitro fertilization, includes removing the eggs out of the body of a woman and fertilizing with sperms in a culture dish, which is outside. Okay. So please understand the question. What is the meaning of IVF? IVF includes removing the eggs of the out of the body of a woman and then fertilizing with the sperm in a culture dish. Is it true or false? 100% of you have said yes, it is true. Question number 3 is IUI. The intrauterine insemination involves placing the washed sperms into the uterus of the woman. Please understand the question. IUI, which is intrauterine insemination, involves placing the washed sperms into the uterus of the woman. Is it true or false? Okay. We have 20% of the people saying false and 80% saying true. Some more variations in the answer. 83% have agreed to this and 17% say no. We'll look at the correct answer at the end of the session. We'll go to the next question, question number 4. Question number 4 is ICSI means intracytoplasmic sperm injection, involves injecting a sperm inside one egg under a powerful microscope. Is it true or false? ICSI involves injecting a sperm inside one egg under a powerful microscope. Is it true or false? ICSI means intracytoplasmic sperm injection. So all of you, 100% of you have answered this as true. We go to the question number 5 now. Egg donation involves transferring your eggs to another woman to carry your baby. Okay. Egg donation involves transferring your eggs to another woman to carry your baby. So this may be a little confusing. I have different opinions coming in. Okay, we have 5 more seconds left. Little confusing this is, but 80% of you have said true and 20% have you have said false. We look at the answer at the end. We go to the question number 6 now, which is surrogacy involves transferring your embryos into another woman's uterus to carry the baby. So this is completely opposite from the previous question. This question says surrogacy involves transferring your embryos into another woman's uterus to carry the baby. You have 5 more seconds. And so far, all of you have said true. We have last 2 questions. Question number 7 is ART, that is assisted reproduction technology, offers 100% pregnancy rate. This is a question every infertile couple has. That do we get 100% pregnancy? Is it 100% or less than that? Can you guarantee pregnancy with ART? Is it true or is it false? Today we'll break the myth on this question. So far, all of you have said false and 0% of you have said true. Last question on the screen coming to you. Ovum pickup involves picking up of eggs from the ovaries. Ovum pickup involves picking up the eggs from the ovaries. Ovum means, you know, basically ovum is the egg. It's a different name for, technical name for, scientific name for eggs. So picking up ovum means involve picking up the eggs from the ovaries. Is it true or false? So 80% of you have said true and 20% have said false. Very interesting questions. We come to the end of this small game kind of a quiz, which only evaluates how much you know and how much you will learn in the session. To learn more on all these questions that I just asked you, I'm very, very happy and I would like to request Dr. Duru madam to come and give the presentation. A quick introduction about ma'am. We all know her by so far. Most of you have been attending the sessions. Ma'am is the founder president of the PCO Society of India and the director of Gynac World, the Women of Women's Health and Fertility. And today we are doing this program only under her guidance. Ma'am is a panelist on various hospitals in Mumbai. She is an international advisory board member and she has received several awards, including some awards for her lifetime work in this field. And it's an honor for us to have you in today's session. And this is going to be the last session about the treatment of fertility before we go ahead next week and talk about this all with all the experts. So I request you, ma'am, to kindly take over from here and give the presentation. Over to you, ma'am.
Thank you very much, Ruby, for introducing me, and I'm very happy to be here. I hope you can see my screen. No? Let me put it on. Can you see my screen now?
Not yet, ma'am. Until you share the screens, let me tell everybody that, ma'am has, been through all the sessions and ma'am has covered in the previous talk about IUI also. Ma'am has covered about the first line of treatment, whether it is use of oral drugs to induce ovulation in the women who have amenorrhea who have too many eggs but they don't ovulate. Followed by that, ma'am also spoke on, injectables, whether these are gonadotropins, use of FSH and other recombinant injections. So whatever the latest technologies, ma'am has already thrown some light upon this. And as we know, ma'am is a pioneer in this field. This is like a revision for everybody that, what all treatments are available. So even if you or any person who has PCOS, don't worry, there is hope, ray of hope for those you who want to have a baby. It's just that you should know and you should approach at the right time because age is a very important factor and you should approach the right infertility specialist rather than, only researching it or, looking for information on Google and Instagram videos and YouTube. So reaching the right qualified person and learning more about infertility is very, very important to those who have PCOS. Not only about cosmetic issues, this is more about fertility and other non-communicable diseases like issues for a woman at her later years of life. So ma'am, if you're ready, if you're able to share your screen.
I'm sharing my screen, but I don't know if you're seeing it. That's my problem.
If you want,
Are
we
you
can
seeing
start sharing at the back end, ma'am.
Are you seeing it? No?
I will check with the technical team, ma'am.
Yeah.
I'll just check with the technical team. In any case, we can always start sharing from the back end. I'll just confirm the technical team.
Yeah. Can you all see it now or no?
I can see only half.
You see it now?
Yeah. Ma'am, if you can start giving a presentation, we already have the technical team who
But
has started displaying.
I need to control my slides. That is the reason why I need to share it from my screen. I'm going to start all over again because I've been trying to share it all the time and it doesn't show up. I don't know why.
No problem, ma'am. You can
Let
switch
me
it off
try it
and
again. Yeah, so I'm starting the share. I'm putting it on screen, starting the broadcast. And
yes, ma'am. Now we can see your screen.
yeah.
And
Right?
we're good to go, I think. Yes, ma'am, we're good to go.
Good. So thank you very much. I'm sorry for this delay in the presentation, but I'll go ahead right into the assisted reproduction section of infertility. Now, as we know, ART or assisted reproductive technology, by definition means that it is where the eggs are removed out of the body and the embryos are also created in a laboratory and they're all handled outside the body and in the laboratory. So it's assisting the formation of embryos outside the human body, and that's what is assisted reproductive technology. These are some of the equipment you see inside the lab, and they're very, very complicated equipments there. So I think we cannot discuss those now. But I want to go through the physiology of reproduction once more for people to understand what's going on. So here you have the ovary and you have the fallopian tube, you have the uterus and you have the vagina. Now every month one egg comes out from the ovary, as we have discussed in the previous presentations. And you've seen here that the egg gets picked up. Once the egg gets released from the ovary, it's called ovulation. And the egg gets picked up by the fallopian tube, which has got like fimbria or finger-like processes here. And the egg travels out into the fallopian tube, which is about 4 inches long, and it is a little tortuous and it's a little, sort of tiny in diameter. And that is the time if the sperms get into the vagina, there is intercourse. The sperms move fast. They have a tail which goes like this and helps to propel them into the fallopian tube. And the two meet over there. This is where it meets inside the fallopian tube. Inside the fallopian tube, there are such processes which sort of finger-like processes or the hair-like processes which help the egg to move towards the sperm and helps the sperm to move towards the egg. And once the egg meets the sperm, fertilization takes place. And then it is called a sort of a fertilized egg, which then moves into the uterus and implants over here when it is called an embryo. This happens 5 days. So this is where the fertilization takes place. This is the egg coming out of the ovary, getting into the tube. These are the sperms getting in, and they both meet somewhere here. And then when the blastocyst or the embryo keeps making more and more cells, it starts with the two egg and the sperm joining together. It's called the fertilized egg. Then it becomes 4 cell, then it becomes 8 cell, 16 cell, and 32 cell. All that happens in the fallopian tube, where they get a lot of nutrition. And that embryo, once it reaches the 32 cell stage, it's called a blastocyst. This blastocyst comes and then implants into the uterine cavity, into the endometrium. This is the inside lining of the uterus, where if it is well developed, the embryo can implant. And this is exactly the endometrium which comes out when you have your menstrual period, if there is no pregnancy. So when there is no pregnancy, when the woman is not sexually active, or if there has been no fertilization of the egg, then in that case there is no embryo, and that egg just falls off and gets discarded through the vagina, or it gets disintegrated. But if there's an embryo, and which, if it happens and it implants, it is this lining which nourishes it. And therefore, when women say that they've got their period, they cannot go to the temple, they cannot perform rituals, holy rituals, etc. And they say that's not, it's bad blood coming out. And I always believe in telling them, this is not bad blood. This is the same food which was nourishing your embryo. And that is what is good. So you don't call it bad, you call it good blood. And that is a good nutrition reaching the embryo, which is helping the embryo then to grow into a fetus. So this is where I'm talking about physiology. Now, infertility can happen, as we said, the egg may not come out from the ovary, or the egg comes out, but it doesn't go inside the fallopian tube because the tube may be blocked. Or even if the tube comes here into the uterus, it may not meet a sperm. If it meets a sperm, it may not get fertilized. Either the egg quality is not good or the sperm quality is not good. And even after the embryo is formed, the embryo may be a little abnormal, and therefore the uterus does not accept it, and the embryo comes out. And the embryo comes out and doesn't stay back into the uterus, and it doesn't implant, and therefore we cannot call it as a pregnancy. So in short, there are various reasons why a woman may not get pregnant, and today we are going to discuss how we can assist a woman in getting her pregnant. So there are two factors. One is that the egg should come out, which we have discussed in PCO patients, that the egg doesn't come out easily, or it comes out every 2 to 3 months. So we give her oral ovulation inducing drugs. If she's obese, we tell her to lose weight, and when she loses weight, she's getting her hormones under control. And when she does that, the ovulation starts, the egg is better quality and meets the sperm and gets fertilized. If the male sperm is not good, and if it's very few sperms in quantity, or if the sperms are not motile and they cannot go up all the way here, then again there's infertility. So on an average, you may find that 40% is a problem with the woman, 40% with the guy, and about 20% is a common factor between both of them. There are many, many reasons why a woman may not get pregnant. So let's look at how we can help women. So if you talk about assisted reproductive technology, there is some work which happens in the clinical side, that is with the doctors. And some work happens in the lab, which happens with the embryologists, who are special technicians who know everything about fertilization and the human reproduction. So we have come to the last stage of assisted reproduction. Now, how it all started was, there were two physicians, both of them have received the Nobel Prize for this, and one was a clinician and one was a embryologist, and both of them did a lot of work on animals, and they did human sort of procedures, and finally it was in 1975 that the first IVF baby was born. And since then, it's no looking back. Things have just improved. Everyone has added on to a little bit more, and things have got so good that we are getting pretty good pregnancy rates, and we are able to do much more than what we were doing in the past. Yet, we can't give you 100% sort of a guarantee that you will get pregnant. So just let's look at what can be done. So when we come to assisted reproduction, we have come to a stage where a woman definitely needs very intensive, excellent help, which will give her the best pregnancy rates. So what we do is we have ovarian stimulation with injections, which we discussed the last time. We talked about follicular monitoring, how the eggs grow. We talked about hormone assays, how we can decide whether the hormones are good or not, where the eggs are concerned. Is the egg growing well? Is it a good quality egg? And the last part for the clinician is to pick those eggs out of the ovaries when they are ready, when they are mature, and then transfer the eggs into the laboratory, which is next to the operating room. In the meantime, what the embryologist is doing, getting ready to receive the eggs, all that preparation starts at least 48 hours before. The lab is completely cleaned because the whole lab has to function the way a uterus functions. So we have to create the environment in the lab to receive the eggs in the most sterile condition, in a similar temperature as it is in the human body, and also have the same, there should be no volatile elements, sort of toxins in the air, so there's air fertilization. There are a whole lot of units which exist to keep the environment very clean in the lab. Then in that lab also the sperm is retrieved from the husband. The husband is given a container to collect his sperm. The semen undergoes a process whereby the semen can be, the good sperms can be separated out from the not so good ones. And this preparation of sperm is kept ready so that this preparation is then used to fertilize the eggs. Now, once the sperm and the eggs are put together, this is how it all started. One egg was put in a dish. Initially, it used to be put in a test tube. And that's when we called it test tube baby. And we have done this when test tube baby, it was still done in tubes. And that's the time we started training on how to do the procedures. Everything was done in-house. Creating the media. The media means the solution in which the eggs and the sperm survived. So we made everything in-house, including the tubes, including the sterile water, the distilled water, which had to be distilled 7 times before we could use it. It was a lot of hard work. Today, things are much easier because so many services are available. So many things are ready-made available. And these are all, disposables, which you use once and then throw them away because they are potentially contaminated after they've been used. Hence, ART or assisted reproductive technology becomes expensive because all these things are tested with embryos to see that there's no toxin in that catheter or in that glass tube, which is going to pick up the eggs. It should not damage the eggs. It should not cause toxicity. So those are all, media, all the equipment we use, all the disposables we use is all very, very precise and very expensive because everything is, as of now, quite a bit of it is imported. There are some things which are available in India now, made in India, and we do hope there'll be many more made in India which we can start using and with good results. So what happens is when we get the eggs, these eggs are kept with the sperm. It started like this, that one egg was kept with 50,000 sperms around it, and the best sperm would then fertilize the egg. Or that means it would enter the egg. So the egg is here and the sperm is here. It enters the egg because of its motility. Once it gets into the egg, the tail is knocked off and only the DNA, which is in the head of the sperm, gets into the egg. And that's how an embryo is formed. Day after day, you can see how the embryo is growing. And when it reaches day 5, that is the day the embryo is transferred in the operation theater into the patient. Now, if you look at what's happening in the lab in the meantime, whilst the egg and the sperm is with the embryologist, what is done in the lab is the technology. So if we are doing IVF, we are keeping one egg surrounded by many sperms around it, hoping that the best sperm fertilizes the egg. Then you have something called ICSI. ICSI is where you take one egg and one sperm and you inject it into the egg, which will be in a way that you push one sperm itself into the egg. When you're doing IVF, you take one egg and you put many sperms, thousands of sperms around it, hoping the best one gets in. Whilst in ICSI, because we have very limited number of sperms, we have to select the best sperm and put it inside the egg, and that helps in the fertilization. And the last is when there are many embryos formed. Say a woman has many eggs, many embryos are formed, that the embryologist is freezing the extra embryos so that they could be used later for at some other time. So this is basically what is happening for those 5 days within the center where you're running your IVF. And before that, of course, for the previous 14, 20 days, you're on medications, you're on injections, you're undergoing hormonal and ultrasound monitoring. And when you get ready, that's when you go into the pickup in the operation theater. Of course, there are variations of assisted reproduction when you talk about female partner and the male partner. Now, what are the variations? Like I told you, initially it was these two specialists. One was Dr. Patrick and one was Septo. And both of them got together and did the IVF. And when they did it in that particular patient, she had blocked tubes. And that woman had already undergone some 50 or 60 procedures before she actually got pregnant. And unfortunately for her, that pregnancy didn't do well. It didn't grow. But fortunately, the next one, she did well and she carried the pregnancy to term. Now, question is about when you have there are so many variations we hear in assisted reproduction. One is talking about egg donor. One is called sperm donor. Egg donor is when a woman hardly has any eggs left in her ovaries or they are not good quality eggs. She takes eggs from another young person who is an egg donor. So women who are usually above the age of 35 may have a situation wherein they may not be having good eggs and therefore they may be using the eggs of a younger woman. Then you have sperms which are taken from a sperm donor in single women. So you have women who have the husbands have no sperms. The woman may use donor sperm, but she may be a single woman and she doesn't want to get married, but she still wants to have a baby. So she can use sperms from a sperm donor and have that baby. Then there's a surrogate where a woman's uterus is not good or not healthy, and she transfers her embryos, which is made from her husband and from her own eggs. Those embryos are transferred into the surrogate. The surrogate carries it for 9 months in her uterus like any other woman would. And once the baby is born, the baby is handed over to the original, who owns those embryos. Of course, there's a lot of legal formalities now because of the new guidelines and new rules by the Government of India. There's a lot of legal paperwork involved. But yes, if it is needed for a patient, it can still be done with certain conditions to be followed. Then we have freezing of embryos. I'm talking about all what has happened after the first test tube baby over the last more than 45 years of assisted reproduction. Then you have freezing of embryos. Now, freezing of embryos, if you have extra embryos, previously we couldn't freeze them well. It used to be like slow freezing. It used to give very poor results. Now we have vitrification or rapid freezing. The embryos are put inside a little capsule and kept inside liquid nitrogen, and they stay very good and we get excellent results with them. So if there are extra embryos, we don't need to throw them out. In the past, all the embryos which were made were put inside the uterus. So women started having 5 babies, 6 babies, 7 babies, 8 babies together. That created a lot of complications and a lot of morbidity for the babies. So today we have realized it's best to have only one or maximum twins. That's it. And all the extra embryos are kept frozen so that they can be used the next time she wants to get pregnant. Or if she doesn't get pregnant, she can try again. We freeze embryos also if a woman is not ready to get pregnant very soon. She's got married young, she wants to work, she doesn't want to have a baby now, she wants to have baby 10 years later. That's no problem because the eggs which have been frozen are the younger eggs which will have more healthy embryos as compared to her trying for a pregnancy 10 years later. Then there may be a woman who may be married, who wants to delay, a woman who's unmarried, who hasn't found the right partner. It may be for medical reasons where she's having a medical problem and she's not allowed to undergo IVF or to carry a pregnancy. And therefore, she may have a problem with her uterus and she cannot carry the pregnancy. So embryos are frozen. Say women who have fibroids in their uterus. If they have fibroids in their uterus, and if it's in the cavity of the uterus where the baby is supposed to be housed, we have to first remove that fibroid. So instead of waiting to remove the fibroid, we get the eggs out because they're the younger eggs. Then remove the fibroid, because after we remove the fibroid, we have to wait for almost 4 to 6 months before we transfer the embryos in, because we do not wish her to get pregnant within 4 to 6 months of undergoing surgery on her uterus, because there is a risk of that scar giving way if the uterus expands into the 9th-month pregnancy. So there are various reasons. Similarly, there may be a woman who's got pregnant with her first try and she's got many embryos sitting in our bank. We keep it all in our own bank in the IVF center. And she decides then to donate the embryos, donate it to a person who doesn't have the means to have a baby, who cannot really afford the full IVF. And then these embryos can be donated to people who do not wish to go through the whole IVF process themselves, mainly due to financial reasons, and they may opt to have these volunteered or donated embryos, where the genetics will not be the same as the couple in whom the embryo is put, because these embryos have been made by, say, couple A, and these embryos are put into the uterus of couple B. So the genetics will be not the couple B's genetics, but the lady of couple B will carry that pregnancy, and it's frankly, no one remembers that this is a donated egg or a donated sperm or a donated embryo. As long as the baby is born and looked after by them, I think all that attachment, all that love develops then. So I don't see any reason why women should shy away from this. Whilst at the same time, with a male partner, you will find that sperms are borrowed from a sperm donor if a man doesn't have his own sperms. Eggs are borrowed by single men who don't have single men don't have a female partner, they don't have a wife, they may want to have a child. Then they use a surrogate, they take an egg donor, but again, this is banned in our country now. But gay marriages, when they are legal abroad, that's what happens when there are two men getting married. They use an egg donor, they use a surrogate and have their babies. Then, of course, there are men with no sperms in the semen which they ejaculate. It could be either that the sperm has no way of coming out because it's obstructed, or there may be no production of sperms at all because of some reason, some injury, some infection, something has happened which is preventing the sperm production, and it has caused absence of sperms in the semen. In that case, we do various technologies we use called TISA, PISA, testicular biopsy, wherein we extract the sperm straight from the testes and we get sperms, but honestly, the results are not as good as they are with the sperms as we get them from the semen. Then, of course, you may freeze sperms, especially because men undergoing cancer treatment have to freeze their sperms before taking the chemo and radiotherapy. Similarly, women also, if they are undergoing cancer treatment and they want to have babies later, they freeze their eggs much before taking and immediately go through the cancer treatment. This is very important because I think this message all must remember that freezing your fertility is important, especially if you're young and you want to have babies later. Before jumping into cancer therapy like chemotherapy or surgery or whatever, radiation, please freeze your sperms or eggs so that you can use them later when you can plan to have a baby yourself. So, and the commonest reason why we are freezing sperms today is because IVF has become so common that, husbands cannot be there all the time. So they freeze their sperms. They're traveling all over to various places. Sometimes the wife is in one part of the country, the husband is in another part of the world. It becomes difficult to get them together. So whilst the woman is undergoing treatment, if we need the sperm, we use a frozen sperm, and it gives us equally good results. So these are the various variations of assisted reproduction. And that's why we call it all as assisted reproduction, which is commonly known as IVF, because in vitro fertilization. In vitro means outside the body, fertilization is occurring. So before we start an ART cycle, as we call it, we always evaluate the couple, make sure she's normal, make sure that her hormones are normal. If her thyroid is not okay, we correct the thyroid. If she's got good amount of eggs in the ovaries, we have to ascertain that, because if she's got good amount of eggs and good quality eggs, it's worth going ahead with her own eggs. If she's 40 and she's got hardly any eggs in her ovaries, we counsel her accordingly. Not that we don't try with her own eggs, we do try. But even after trying, and when we do the IVF, we get an opportunity to look at the eggs under the microscope. And we can realize that maybe these eggs are not the best. But still, we go ahead and then we try. And if it fails, if there are no eggs, or if very poor quality eggs, if poor quality embryos, then the patient understands, and then she may decide that she may want to go for egg donation. But egg donation is something is offered as a last resort, because we want the patient to get pregnant with her own eggs as far as possible. But in a situation when it's not possible, we have to resort to egg donation, provided the couple is agreeable to it and they are willing to sign, sort of a consent, wherein we ask them before doing the needful. And then, of course, it involves doing the husband's test, doing the semen routine, the blood test, the physical evaluation if needed, etc. So these are the various things we do, and then we go to assisted reproduction. I've got some nice videos on this, which I'll show you at the end of the presentation, but I'm just trying to explain to you here what happens. So here, what I explained to you is that we monitor the eggs growing in the ovaries, and when the eggs are ready, when the size of those follicles reaches 18 millimeters plus, 18 to 20, that is the time we know that the eggs will be ready. And then we give an injection, which we call the trigger, which helps the eggs to mature well. They get matured within the ovary itself. And then we do ultrasound, and under anesthesia, we put in a needle from here into the ovary, like this. Needle from here into the ovary under ultrasound control, and one by one pick up all the eggs which are growing in both the sides of the ovary. Then we give it the eggs to the embryologist. She keeps it for IVF. See here, she's kept one egg here, and there are sperms all hanging around waiting to go, and there's only one sperm which will finally get in and fertilize the egg. So this is what is done. And what we have seen in IVF is that we need to keep them in little culture dishes. We have to keep a medium inside, which is the nutrition part of the sperm and the eggs. And the idea is to keep a great environment, which is optimum and just like within a mother's uterus. So this is called IVF. Now here, I'm showing you how the sonography picture looks of the eggs growing inside the ovaries. And this is done, on a regular basis every 2-3 days to see how the eggs are growing. And when the eggs are ready, we give the trigger, and then we do a pickup. A pickup means we pass a needle in. We have a guide to show us where to go. We go in, and by one, we pick up the eggs from all these follicles. When the egg is aspirated out, the fluid, what you see, this black portion is actually the fluid around the egg. You can't see the egg here. But when you put the needle in, with suction, the fluid is removed in a test tube. The fluid in the test tube is given to the embryologist. The embryologist pours that fluid into a culture dish, and under the microscope, she can see the egg. She picks up the egg from under the microscope, puts it into a dish with good culture medium, and puts it straight into the incubator. Because the mother's body temperature is 37 degrees centigrade, and therefore they have to keep the egg at that temperature. We also keep our OT and our lab with, we try and keep it at 27, 28 degrees, and we are all very hot, but that egg needs to be kept warm, and so we have to do this. And it takes about 15 to 20 minutes to finish the procedure. After the procedure is over, the patient rests for some time, and then after a few hours, once she's okay, she goes home. Now, if you look at this egg, this is the egg. And this is what you call the zona, the covering of the egg. And this is actually the egg. This is magnified 400 times. So the egg you cannot see with the naked eye. This is magnified 400 times under the microscope. And this is how the egg looks. And this is one egg, as I told you, is kept with many sperms around. If you see here, there are thousands of sperms around it. And then if you see the next day, after 16 to 18 hours, you'll find that one egg has got into the egg, one sperm has got into the egg. And the next day you will see that it's a 2-cell, means it's divided. This thing is divided into 2. And after a few hours, you'll see that it has divided into 4. Then it divides into 8. And on the third day, after the eggs are picked up, it will be a 8-cell stage. So it reaches 8 cell, then the next stage on the 4th day is 16 cell, and on the 5th day it is 32 cells when it is called a blastocyst. So this is what is done, and this is done by the embryologist in the laboratory. And I think with IVF, the almost 90% of the expertise lies with how good your embryologist is, how precisely they do the job, and how precisely they maintain everything in your laboratory, and that's extremely important. Of course, the clinician is equally important, but if I had to decide between the two, I would say an embryologist is really a good embryologist is absolutely necessary. Now, this is where you come to ICSI. This is all done under the microscope. What is done is that one sperm, this is one sperm identified under the microscope, is picked up into this cannula. Okay, this cannula is then pushed inside the egg. In the meantime, the egg, otherwise it would wobble, but it is kept in place with another cannula where there's suction attached. Now, all this is very, very done so beautifully that there's no damage to the egg or to the sperm. So here, this needle goes inside, the sperm is deposited inside the egg, and then the needle is withdrawn, and then you keep it in the lab. Now, here there is one egg, one sperm. So this is called ICSI, intracytoplasmic sperm injection. That means the sperm is injected into the cytoplasm of the egg. Of course, in that, if you see that there would be many reasons for you to do it, like the indications given here, where there is very severe male factor, means that there are very few sperms seen, or if after an IVF cycle you find the patient, the eggs are just not getting fertilized. That usually happens in women who are older, where the zona, means that the covering of the egg is pretty stiff. So in that case, we do ICSI, because when you do ICSI, you're going through that shell and getting in. And when the embryo is formed also, when we transfer those embryos, they actually, when you put them inside the body, the outside capsule or the zona then opens up and the embryo comes out. So in those patients where you find that the zona is very thick, we may use laser to make an opening into it to help the embryo to come out before we transfer the embryo inside the uterus. Then, of course, both of them give equally good results, so we don't need to worry about that. But when we have embryos, we transfer the embryos then on day 5 through a very fine catheter into the uterine cavity. It's all done under ultrasound control, so you know where to put the embryos and they are not being placed somewhere else. Then, of course, if there are extra embryos left, we freeze those embryos, and that's called used later on, and that cycle is called a frozen transfer cycle. If you compare the frozen rates of pregnancy with IVF and with ICSI, they are almost similar. And if you see the age, when they are less than 35, you've almost got a 50% success rate per cycle. But as the age goes up, if you reach the age 42 in Indian women, the fresh cycle rates are only 12%, whilst frozen cycle gives you a better rate, because these frozen embryos have been probably produced way back when they were 35 years old and they are being put in later. So in short, the frozen cycle transfer gives you better pregnancy rates later on, but between the age of 30 to 40 years, they are giving you a 40% pregnancy rate. But see, from 50%, it goes down to 12% at 42. So age is extremely important. If you have to do an IVF, please do it earlier. Don't wait till it's too late. Then, of course, you can freeze fertility, as I've mentioned, which you can freeze all the extra embryos. You can freeze your eggs. You can freeze eggs because you want to prevent too many eggs from ovulating inside. And there are multiple advantages of, saving the embryos, because you can keep using them again the next time. In the freeze cycle, you don't need to take the injections. You just take tablets, prepare the lining, and then put the embryos in. So you have all kinds of freezing. You can do eggs, you can do this ovarian tissue can be frozen, especially in young girls who get cancer at a young age. We freeze their ovarian tissue, they can freeze sperms, embryos. The medical reasons for doing it is young cancer patients undergoing chemo or radiotherapy. Prior to that, I've spoken about all this. And in women where we find that they are likely to reach menopause early by doing their test, then in those cases, we tell them to freeze their eggs and keep, so that they can have enough eggs to have a baby in later life. Now, that is also another situation which is called social egg freezing, where we have career-oriented women, we have got late marriages, we have got increased rate of divorces, remarriages, delayed childbearing. All these are indications for you to freeze your eggs in advance. Similarly, sperms can be frozen, especially with men who have had a spinal cord injury, where they have problems with ejaculation after that. So it's good that they freeze their sperms, which we can help them with vibrators or with different techniques. We save their sperms and keep. Of course, men undergoing cancer therapy and other issues I've said. We also have third-party reproduction, where we do egg donation, where if a lady has very few eggs, the wife, and the husband has few eggs, husband has good amount of sperms. So they use a young donor who's given all the injections. She's monitored. Her eggs are retrieved by ovum pickup. They are fertilized with the husband's sperms. Embryos are made, and the embryos are transferred into the wife. So then she carries the baby. Sperm donation is very simple. You ask the man to we get sperm donors, young men going to colleges, etc. They are very happy to donate their eggs. Their sperms, and those sperms can be used in a woman where the husband says, I'm happy to have a sperm donor because I don't have sperms. And in those cases, sperm donation can be done. Of course, in that case, eggs are not retrieved. When she ovulates, the sperms are put inside. You have surrogacy, wherein you've got good embryos, but you don't have a good uterus. So you transfer them into another woman who carries the baby for you for 9 months. And then legally the baby is handed over to you. Of course, a lot of legal procedures are involved. We talked about embryo donation also. Uterine transplant is when somebody's uterus is completely absent, or it is destroyed due to some surgery, or it's due to she's born without a functional uterus, or the uterus has got ruined because of some infection. So these are the various indications where you would use egg donation. Usually it's advanced maternal age, if she's had a premature menopause, if repeated IVF failures, and some women are born without functional ovaries. And as I mentioned to you, there are various reasons why we would do egg donation. When ovaries are destroyed with endometriosis, with ovarian cyst, if there are genetic disorders which are getting transmitted through the eggs. So in those cases, you may use an egg donor. Then donor egg and cell transfer is what I've talked about. Surrogacy I've talked to you about. And of course, the reasons why you would use a surrogate: if there's absence of the uterus, surgical removal, and if there is a destruction of the inside lining of the uterus, so the embryo doesn't implant, or if the mother's got a severe heart disease or a kidney disease or cancer, and she's not allowed to carry a baby, then she uses a surrogate. Uterine transplant is being used, and more than 80 transplant procedures have been performed. More than that now, which have resulted in almost more than 40 births. It gives an 80% success obtained due to successful transfer. But the problem is that the woman who carries the uterus, and uterus donated to her by someone else, in those cases, she has to take immunosuppressants, drugs always. Once she's finished with her childbearing, then she undergoes a hysterectomy to remove that foreign tissue out of her body so that she can stop taking the immunotherapy. At the end of it, we have a lot of advances going on today. We are using artificial intelligence to select the best embryos for implantation. There's a lot of genetics being involved. We can actually biopsy the embryo and look for any genetic disorders in those embryos like thalassemia major. We can look for any diseases which are transferred genetically. So there's a lot of manipulation happening, but this is still in the experimental phase where the bad genes are removed through a genetic editing technology and giving rise to babies born without those genetic problems. So there's so much excitement in this field, there's so much going on, but yet technology is still not able to to help every couple, in spite of them spending 2 to 3 lakhs for an IVF cycle, going through the pain of injections, traveling, waiting for hours in the IVF lounges, and then having only a 30 to 40% success rate. Now, the 50% is for women who are younger. 30 to 40 is the average percentage which you look at. And we do empathize with our patients. We know they are going through a lot of emotional and financial strain. But let's remember there is hope today. There was no hope in the past. Today there's a lot of hope. There's a lot of people who do get help with this technology. And I think there's much more which will come in the next 10 years. And I'm sure there'll be a day where all of us will be able to probably say, yes, 100% we can offer you a success, but today we cannot. And therefore, people used to put in more than one embryo, more than 5 embryos, hoping that it'll give success and it'll give a pregnancy, but it gave rise to a complication of multiple pregnancies. So in short, we are still at the stage where we cannot offer 100% guarantee, but yes, we can help many of our patients who had no support before. So thank you very much for being with me, and we look forward to the next episode, which will be coming soon, which I think Dr. Duru will announce. But if you have time and if you're keen to look at those videos, then we can put them on. Or after the session is on, we'll keep it on. Those who would like to stay back and look at it, it'll be most useful. So thank you very much.
Thank you so much, ma'am, for such an interesting topic, where all the doubts about IVF has been cleared. In fact, there are many other questions which may arise out of this. We'll take up all the questions when we do Q&A session. So I request all of you to stay back and be a part of the question answer session. But I think we'll play 1 or 2 videos, ma'am, because you've just heard your talk. So I request the technical team to put one of the videos to begin with. They've just heard, ma'am, and it'll be easy for them to understand what actually happened. There's so much that we don't understand when a doctor is explaining in a clinic. But today, when you see what actually happens, it makes a big difference, helps them understand the actual procedure. So if you can see one of the videos.
Making a baby isn't always easy. Fortunately, there are many ways to parenthood, including in vitro fertilization, or IVF. This treatment process brings the miracle of conception into a laboratory. During the multi-step procedure, mature eggs are retrieved from ovaries and fertilized with sperm in a petri dish. It takes a few days for the fertilized eggs to develop into embryos. Within a week, an embryo can be transferred into a uterus in hopes of starting a successful pregnancy. IVF has been used by want-to-be parents for more than 4 decades. It has led to the birth of nearly 10 million babies since the first successful fertilization procedure. Talk openly with your healthcare provider about your options.
Four cell, and then it becomes 8 cell, then 16 cell, and then finally reaches day 5 into a blastocyst. And that is the time we transfer it into the uterus. So this is a blastocyst. See, it's nicely expanded, And this is how it looks on day 5 after the egg and the sperm have joined together.
Oh, it looks so fascinating. He's looking at the sky. I remember as a child when you look at the sky and you understand what a planet's like. It's so fascinating. Similarly, what nature is so beautiful that luckily with the technology, the assisted reproductive technology, all this is possible today in a laboratory. And this makes us understand from a test tube baby why it is called ART now, or IVF, in vitro fertilization. Thank you so much, ma'am, for giving so many insights on this whole thing. And I think this has really has inquisited a lot of questions among the participants today. I'll ask some of the questions which are there. Some of them, have personal questions, but I may not take those questions. I'll just ask some general questions. Okay. Ma'am, one question is, can one select the best embryo if, before transferring the embryo into the uterus?
There are certain criteria which have already been developed and atlased already, so that they tell you this is grade, the best grade embryo. So there is various things you look at. You look at the amount of sort of abnormalities which you see within the embryo, like dots you see, granulation you see, how much it's expanded. So there are various ways you can grade the embryos. It's still not 100%. We cannot talk about whether they are abnormal genetically or not, but by the look of it, you can say it seems normal. But today, many research labs are coming up with artificial intelligence to identify which are the best embryos, and they are soon going to be into use, and we'll be able to have more information on the embryos before we implant. So genetically, we can determine whether the embryo is normal or not is only when we do a biopsy of the embryo, send it for testing, get the result, and only then we know whether it's normal.
Okay. So I think with time, more and more procedures will evolve and there'll be more and more technologies available to it.
Yes.
There's a question, ma'am, Anamika is asking. My husband's sperm count is very low. Okay. And she's not mentioned it. Which is better, IUI or IVF?
See, there's always a limit on what we have seen. See, if there are no other issues and only the sperm is a factor, means where the wife is not, older in age, where she's not got any endometriosis, no PCOS, no nothing. Everything is normal with her. And the husband has a low sperm count. We normally try to find out why has he got a low sperm count. Normally, we find blood sugar may be high. He may be having some problems with his testes producing the sperms. He may be low on the hormone. So after we have examined him and we have also found out his other reports, we try and correct it. Now, to get it into a better mode. But honestly, where men are concerned, it becomes very difficult to bring back a normal looking sperm because it takes almost 3 months to get a result. What production starts today comes out only after 3 months. So you won't see the answers. You waste a lot of time. So if it's an older patient, I would say go for the best, treatment, and that is IVF. But if she's younger, she can try a few cycles with IUI. If at least there is a 10 million count in the semen, you'll get good results. Say 10 million after washing the sperms, after taking out the active sperms. If he's got a good 10 million count of washed sperms, then the results are pretty good with IUI, provided her tubes are open.
Okay, so at least minimum cutoff you should know, Namika, that at least 10 million sperms after post wash. That is, so and of course other evaluation factors which ma'am has said. So then you can decide with your consultant which would be better, or you can write to us. We'll help you to we'll guide you further whom to connect with. There's another question, ma'am. Bijal is asking how many years the egg can be frozen.
It can be. As of today, we have got eggs and embryos frozen with us for years together, for 8-10 years. And usually there's no harm concerned. There have been studies which have been reported where they have kept and frozen them even up to 5 years and used them, and there have been no issues. So in short, there doesn't seem to be any harm which we are creating, especially where we are concerned, where we have kept it frozen. Is it going to cause any harm? But no. As of today, nothing has been found to be causing any abnormality, provided they are frozen well.
I think she's typing one more question. It reads, actually, my job is transferable. Okay, what if I shift somewhere else after 2 years?
So normally we used to even transfer if the patient moves out to another country, or we used to transfer the embryos to the other country also. There are courier services available. But now with the new latest guidelines which have come in, it has been said that because of the latest guidelines, they say that you need legal permission before you transfer anywhere.
Okay,
And
I
we
think
can't transfer even from one clinic to another clinic within the city until you have some permissions taken. That's the problem.
then it's something which has to be considered before Vijay, you try to, to freeze
Just a
your
minute.
egg.
Just a minute.
Sure.
Huh?
So I think Vijay, you need to check with with your doctor that if you will be able to transfer the embryos from one place to the other. But otherwise, there's a legal hassle if you think of doing it immediately. And there's another question flashing. Do I have to lose weight before we start IVF cycle? I am 96 kgs now and I'm 36 years.
Oh, very good. So if you're above 35 and you have put on excessive amount of weight, then it's better to go ahead with the IVF rather than waste time in getting rid of the weight. But at the same time, do exercises, etc. I have a very urgent call from the hospital. Can I just take it for a minute?
Yes, ma'am. I will continue with the other things in the session. So I think till ma'am comes back, and we have one only question left for her to answer. I think we'll quickly take the post poll, which is to understand how much you've understand so far. So I request the technical team to display the same questions once again, so that we know how much of information have we gathered over the last 40 minutes. I request you to display the question number 1, please. The question number 1, we earlier got 100% people saying true. Let's see what is the answers now. Can I have the question number 1 on everybody's screen, please? In the meantime, if you have any other questions, please post it in the Q&A box. I'll take it up when ma'am joins us back. The question is, which I already asked you earlier, ART or assisted reproduction technology. Is it called ART? Is it true or is it false? And I think earlier all of you, 100% of you have answered true, and the correct answer is also true. It is assisted reproduction technology. It doesn't only include IVF, it includes other treatments also, which ma'am said. Going to the next question, question number 2 is, IVF, which means in vitro fertilization, includes removing the eggs out of the body of a woman and fertilizing with the sperm in a cultured dish. Is it true? Is this what which is done in IVF? I think ma'am also showed the videos, and by now all of you are aware that earlier it was done in a test tube and now it's done in a dish. So it is a culture medium. Earlier also everybody said it is true, it's correct. This is how IVF is done, and or now also everybody. So I think all of you know what IVF procedure is like. We go to the question number 3 now. Okay. Question number 3 is, IUI or intrauterine insemination involves placing the washed sperms into the uterus of the woman. This is what IUI procedure is all about. You wash the sperm and you place it in the uterus of the woman. Is it true or is it false? I had a difference of opinion earlier. 83% of you said true and only 17% false. And now, after the session, all of you say that it is true. This is what is done in IUI. Correct answer is true. So yes, it is washing the sperms and putting it in the uterus of the woman. We go now to the next question. Question number 4 is, ICSI, this means intracytoplasmic sperm injection, involves injecting a sperm inside one egg under a powerful microscope. So I just take you back to the video which was played by ma'am. that, is this what is done in an ICSI procedure? There's one sperm and one egg, and they're fused together under a powerful microscope by injecting the sperm and without damaging the egg. So is this what ICSI all about? All of you have answered yes earlier also and now also, and the correct answer is true. Next question, question number 5. Question number 5 is, egg donation involves transferring your eggs, okay, transferring your eggs to another woman to carry your baby. So earlier, 20% of you said false, 80% of you said it. Egg donation, donating, okay, involves transferring your egg to another woman to carry your baby. Suppose a woman has to undergo egg donation. What does it mean? Does she give her own egg to other woman, or it's the other way around? Okay, so this question itself is a little confusing. Earlier, 80% of you said true, and now 67% of you said, but the correct answer is false. Means egg donation means you are taking, the patient is taking egg from the other woman and not donating your egg to the other person. So egg donation means you have to take egg from a younger patient whose eggs are, much healthier. So it's the other way around. The correct answer is false. We go to the next question. Question number 6. Question number 6 is about surrogacy. Surrogacy involves transferring your embryos into another woman's uterus to carry the baby. It's completely opposite of egg donation. So here, earlier everybody said true, and we have 10 seconds to answer this question now. What does surrogacy mean? Surrogacy means transferring your own embryos into another woman's uterus. Okay. So the correct answer is true. Everybody has answered it correctly. Well, great. We move on to the next question. Question number 7. Last 2 questions coming up in the screen. Question number 7 is, ART offers 100% pregnancy rate. Is there a guarantee that all ARTs will give you pregnancy? Is it true or is it false? Earlier, all of you said false, and now also we have 10 seconds remaining, and all of you are saying it is false. There is no guarantee as such. So the correct answer is false. You can't give a guarantee of 100%. Last question coming on the screen is question number 8. Question number 8 is, ovum pickup involves picking up of eggs from the ovaries. Ovum pickup. Ovum is another name for egg. Ovum pickup involves picking up of the eggs from the ovaries. Is it true or false? Earlier, 80% said true and 20% of you said false. What is the correct answer? Ovum pickup involves picking up eggs from the ovaries. I think this is very clear now after the session that it means picking up the eggs directly from the ovary. So the correct answer is true, and all of you have answered true. And I think this is the last question, and I know most of you have answered correct answers. Most of you have given 100% correct answers. Well, we close the poll here now, and most of you have learned about everything with respect to ART cycles today. Let me check if Madam is back, and then I can ask 1 or 2 questions before we close the session. Madam, are you there? Please unmute yourself. Please unmute yourself.
Hi, I'm Dr. Vishesha. Dr. Shah had to rush for an emergency case, so she won't be able to join us right now.
Are you there?
Thank you so much. I think ma'am is seeing another patient team. So I think if there are any questions, okay. Dr. Vishesha, I will ask you a question. If you are able to address this question, it will be great. Otherwise, we can request Dr. Duru Madam to answer this question for the audience. That can relatives donate eggs for IVF? This is a question by Veenu Harika. Can a relative of mine donate eggs for IVF? Or is there any legal binding towards it?
So yes, there is a legal implication towards it. Now with the new ART rules and regulations coming up, it's not possible to just take eggs from any person whom you know. The person has to be registered with the bank, that is the donor bank, as an egg donor. And usually egg donors are anonymous. So I don't think you can use a relative for egg donation. But for surrogacy, yes, you can use your relative for surrogacy once the board has given you permission to go ahead with it.
I think whoever has asked this question, I request you to go back to doctor because the new laws have come in from last year. A lot of things have changed, and you will
Yes.
have to do it as per the current rules and regulations and laws of the country. I think, madam, I will request you to go back and check with them for the legal procedures. We have a last question, okay, and then we will close the session.
Sure, sure.
This is about IVF only. Is
Hmm.
IVF painful and expensive?
So this is really a myth, actually, that IVF is painful. But believe me, IVF is really not painful because the procedures that are involved in IVF include only the egg retrieval and the embryo transfer process, that is putting back the embryos back into the uterus. The egg retrieval procedure is done under complete anesthesia. You don't remember a thing when you wake up. There is no pain or discomfort post the procedure. Next day, you can get back to your work. Also, the process of embryo transfer is just like an IUI or intrauterine insemination, which does not even need anesthesia and hardly takes 10 minutes. So, the only discomfort in IVF would be the injections that you have to take for the 10 days to make your eggs grow. But that too, also, the needles are very tiny and you don't really feel the prick of it. So, believe me, IVF is not painful.
And I think when you have that baby in your hand, you will forget on the pains.
Definitely. Definitely.
And that happiness, you will definitely forget that those 10 days of injections. You'll be so happy that you're likely to have a successful and healthy pregnancy. So I think it's worth it. It's worth it.
Yeah.
And can you throw some light? And that is it very unaffordable?
No, so it depends on what type of cycle you're going to need. The thing is, not everybody who suffers from infertility needs IVF. Sometimes you can just get pregnant by correcting your hormones or doing just a simple IUI, that is the intrauterine insemination. So it all depends on what type of fertility treatment you're going to need. If you're going to need IVF, yes, it is a little pricey. That's because after all, you're making a baby outside the womb in the laboratory. The things that are used in the laboratory are the ones which add up to the cost of IVF. So, depending on your case, it can be decided what type of fertility treatment you need. But not all fertility treatments are expensive.
Okay, so I think it's really worth it, like I said, suffering from the pain and paying a little more price.
Yeah.
So in that case, I think it is because of the advanced age, I think when you don't have a choice. And with, like Madam said earlier in a talk, a lot of things are being made in our own country, and
Correct.
the success rate is much, much higher than what it used to be earlier. So now the
Yeah.
success rate being, so in one cycle itself, you may conceive that the cost cutting happens.
Yeah.
Local things are produced here, so cost cutting happens, and more centers in your in your city itself, nearby centers, cost goes down. I think
Yeah.
it's not as expensive as people think. So go back and
True.
you must check with the IVF centers and your gynecs to understand the cost. Also, like new technologies coming, everybody doesn't need to do all the things in a IVF cycle also. So it is not as expensive as it is said to be. So I think all the infertile couples, we are with you. Please go back and check with your doctor and get all your doubts cleared. And you can also write a mail to us. So with these last words and inputs from Dr. Vishesha, thank you so much for you know coming over in absence of Duru madam. Thank you so much. I formally want to thank for the entire Pieces Society, Duru Shah madam, and the chair, my colleague Dr. Shobna Patar, who is actively involved in this program, and the entire team of Vijeta, especially the people working tirelessly at the back end, Melroy, Vinita madam, all of them who are a great team of Vijeta, and Rochelle, who works really continuously on this project as well. If you have any queries, please write to us at manager.vijeta.pcs@gmail.com, and you can see all the videos of all the sessions that we have done so far on our YouTube channel and the website www.pcs.org. You can retrieve all the videos and understand. And still, if you have some doubts, please get back to us. We will be happy. We do not end the season here. We have one last thing coming up on the 15th of April. So on 15th of April, we will have a team of panelists. We are going to have a panel discussion at 3 o'clock in the afternoon, where we will have doctors from different specialties, an endocrinologist, or not only a gynecologist, but a dermatologist also, and a nutritionist and an exercise specialist. So if you have questions, with different things, we'll all come together to answer all your queries. It'll be a very, very interesting panel discussion. So I request all of you to please join us back on the 15th of April. We will share the link very soon. And finally, this program was not possible if we didn't have support by Philips. So once again, thank you each and everyone for staying with us, and sincere apologies for all the technical glitches that we had in today's sessions. Looking forward to see all of you once again on the 15th of April. Till then, goodbye and have a great weeks coming up. Thank you so much, everyone.
Thank you.